The changes came as a shock.
What this thing does is it measures electrical currency. So
Tinus van Rensburg has spent much of his professional career doing tests like these. They're known as electrocardiograms or ECGs. So he can't fathom why in just a few days he'll suddenly be ineligible for the Medicare rebate to interpret the results.
But it's just another chip away at our funding.
Under the changes, GPs will still receive money from Medicare to perform the ECG tests. But while they're still allowed to interpret the results, they won't get a Medicare rebate for telling patients what they've found.
We're already providing the service at a loss. If you look at the consumables that's used, the time for usually a nurse that's involved, it's the dots that you use, the gloves, in this day and age, the masks.
If GPs aren't prepared to absorb the costs of analysing the test or make their patient pay, they can refer them to a specialist. But that's problematic for regional and remote Australians, where GPs are the one-stop shop for most services. And rather than travelling to a specialist, there are fears some may not bother, risking their heart health.
This is a short-sighted decision, looking at saving small amounts of money, which in the long term will end up costing more.
In the past year, there have been about 3 million Medicare-funded ECG tests ordered and completed by GPs and specialists. The Health Department says these changes will stop unnecessary tests, but they've also prompted an unusual intervention from federal Labor, which typically doesn't get involved in the independent Medicare process.
I really can't see any logic here at all. I'm surprised the government hasn't already backed down.
But a change of heart is unlikely.
That decision was made on medical advice.
Medical advice disputed by medical experts. Stephanie Dalzell, ABC News, Canberra.